health issues in the media, largely, although certainly we could think about other sources of exposure too, and I'll mention some evidence of that. And I'll lay out for you in just a moment kind of what I had in mind for an agenda for today. Briefly, though, I want to acknowledge many collaborators on this work over the last few years, as well as the sources of funding for the studies that I'll be talking to you about. So what I thought we would start by doing is conceptualizing, defining what I even mean by conflicting health information and similarly controversial health information. And from there, I'll move into two case examples. I spent a lot of time thinking about this kind of information in the context of nutrition and then also with mammography screening. And I'll tell you a little bit about what that media content looks like and some of the effects that we've observed as far as exposure to this information is concerned. And I'll kind of close that section with work that focuses on this idea of carryover effects, which was really the I think what drove Kenny to reach out to me today. There was a research brief that our team released recently on a study we recently published on that subject of carryover effects specifically. So I'll spend some time digging into that. I'll say a few words about COVID because this is certainly germane, this phenomenon, very much germane to the context of COVID. And finally, I want to close with implications and really invite all of you to think about what you think of this information, how we can address it, how you in your own roles could potentially be working to mitigate its effects and so forth. So we'll make sure to save time for that. If you do have questions along the way that I can clarify, please don't hesitate to interrupt. So when you think about the health communication environment, the public information environment, it is innately competitive. And by that, I mean, I'm showing you here two examples from the tobacco context. It's purposive planned strategic communication in the context of tobacco, right? So first on top, you may recognize Terry from CDC's Tips from Former Smokers campaign, which has been going on since 2012, huge national anti-smoking campaign. And below that, more recent efforts from FDA, the Real Cost campaign, initially targeting cigarettes, now increasingly vaping and e-cigarettes. So these are sort of purposive planned anti-smoking, anti-tobacco communication efforts. But these do not occur in isolation, right? People are exposed to this information in the context of traditional tobacco advertising, in print and other forms of media, to movie smoking, tobacco use in entertainment media, which we know from a whole body of research has really important effects. The increasing role of tobacco in sort of the social media space, making use of influencers to promote its products. And then, of course, the competitive information environment features point of sale marketing from the industry. So these sort of strategic public health messages are fighting against a broader information environment. And that is, as I said, innately competitive. Another form of competition that we can think about within this space is a little different. And that's really where the focus of my work is. And here I'm really talking about growing concern about messages that broadcast conflicting and often controversial health information. So certainly we see this in the context of e-cigarettes, right? A lot of mixed information about whether these products are good or bad for smokers or for non-smokers, depending on the audience you're thinking about. Nutrition, right? Alcohol, fish, coffee, the list is endless where we see these sort of shifts in recommendations and sort of research findings about whether these food and beverage products are good or bad for our health. HPV vaccine, lots of controversy there in the 2000s and even still today. And then, as I mentioned, mammography screening. But what do I mean by conflicting and controversial? What is this? If you probably have some, innate kind of sense of what I mean, but to give you the dictionary definitions, just to get really basic about it, conflict really refers to, differences or opposing information, right? Whereas controversy sort of layers in an element of heated dispute or disagreement. And I would say that in our experience, conflict and controversy, at least in media, they often co-occur, but they don't always, right? Where you would have sort of conflict about evidence, let's say that where there's like heated expert disagreement that kind of accompanies that, but sometimes that sort of inflammatory content about that debate isn't actually characterizing the conflicting information. So it really does depend. But if we think about what we mean by conflict and kind of going beyond that simple dictionary definition, I've thought about this work in this sort of phenomenon in two ways. First, what we've seen is messages. You could think about conflicting health information as messages that provide information about the same behavior producing two distinct outcomes. Okay. And I think a really good example of this is what we see with nutrition, right? Where one week maybe you come across an article talking about the benefits of fish consumption for heart health. But then a few weeks later, you see another article about fish consumption, a study showing concerns about mercury risks, right? So sort of you're left wondering, should I be eating fish or not? Is this something that I should be doing? Similar example on the bottom here from the alcohol context, right? Heart health on the one hand, risks of cancer, especially breast cancer on the other. And so from that perspective, you could imagine that this is really perhaps decisional conflict, right? Where you're left trying to figure out on a personal decision level, do I want to eat fish? Do I want to eat alcohol or do I want to drink alcohol? And if so, how much? It's a little bit different than another definition of conflicting information, where you could think about messages that provide competing claims about a specific behavior resulting in a specific health outcome, or put another way, two or more propositions or statements that are logically inconsistent with each other. And here I would point to the example of mammography screening. So for some of you, this is going to be maybe more salient than for others. But back in 2009, as an example, the US Preventive Services Task Force got itself in a world of hurt where they shifted their recommendations again, moving away from recommendations for routine screening for women in their 40s, suggesting instead that this should be an informed decision-making conversation that women have with their providers, that in some cases the risks of mammography could outweigh the benefits. And there was, I'll say more about this in a little while, huge firestorm played out, in part because it coincided with debate about the Affordable Care Act. So it was sort of a complex health communication and health policy story. But ultimately, what's sort of conflicting about this is you have propositions that are logically inconsistent. So some professional organizations like US Preventive Services Task Force saying women should start screening at 50. At the time, American Cancer Society still saying age 40 for that. Ultimately, they moved to saying age 45 for routine screening. And then you have American College of Radiology still claiming that 40 is the place to start. So a woman faced with these competing streams of information, these different recommendations, cannot simultaneously engage in all of them. She has to pick. And from that perspective, you could think about this kind of conflict as informational conflict. The information itself conflicts. So just some sort of conceptual insights into kind of what we're talking about here. To dig into examples that will, I think, make some of this even clearer and give you a sense of what kinds of effects of exposure to this information we've seen. The first is nutrition, and you've probably all come across some version of this information in your own experience. You know it's common when The Onion talks about it, right? So this is now from way back in 1999, you know, with the headline, "Eggs Good for You This Week," right? Sort of pointing to just how often there seems to be this whiplash within the nutrition realm of what foods we should or should not be eating. And so you might ask yourself, why? Why does this happen? A lot of it really comes down to epidemiology and the nature of scientific progress and discovery, right? So in some cases, like the case of alcohol, there are legitimately opposing effects, right? There's very good data to suggest that alcohol, especially for those in late life, can have heart health benefits, and that it also simultaneously increases those risks of breast cancer and other cancers, that those two things co-occur. Different study designs can yield seemingly conflicting results, right? Observational sort of survey-based studies on the one hand versus your experimental randomized controlled trials can lead to different types of conclusions, variations in measurement, lots of different reasons for this. And this has been pulled out there's been a few sort of review studies by John Ioannidis at Stanford University pointing out that everything we eat causes both causes and prevents cancer, right? If you look across the nutrition literature, and those prior sort of epi-driven reasons are a lot of the reason for that. What's important about this, I think, is that, researchers, clinicians, they understand. They understand epidemiology, they understand how science happens, and they can kind of make sense of these seemingly conflicting findings. I worry more about the public, right? And sort of the translation of what happens when these studies get reported in the news media. We know that as a country, we continue to have pretty limited understanding of scientific research. The data out of the National Science Foundation continue to show that roughly 1 in 5 Americans seem to know what a scientific study is. And so that can potentially lead to some problems as far as people's capability and sort of readiness to make sense of conflict when they come across it. And then we know that news coverage of health and science can often omit important methodological and contextual information that, again, might help people to sort of negotiate these seemingly conflicting results and recommendations. So, there's been a lot of assumptions over the years in the nutrition literature that exposure to this kind of information in the media has all sorts of negative effects, makes people confused, makes them more likely to engage in healthy behaviors, or less likely to engage in healthy behaviors. And when I first started thinking about this back in 2009, let's say, I didn't question those assumptions. I just questioned the empirical evidence to support them. We really didn't have any data on the extent to which people actually notice this information in the media, and whether it was in fact linked to the kinds of outcomes people were concerned about in the nutrition research space. And so that's sort of where I started, with a basic sort of cross-sectional survey study, trying to first even understand how much exposure to this content people observed. And what I found, this was a national probability-based sample back in, like I said, 2010. So really pretty high quality sample here, representative of Americans over the age of 18. And what we saw is that across 4 nutrition topics, red wine or other alcohol, fish, coffee, and vitamin supplements, that roughly 70% reported having come across medium or sort of higher levels of exposure to this information, and only 10% saying that they never saw this kind of content. Okay, so substantial exposure, verifying those sort of assumptions and concerns that were observed. And then, thinking about those potential effects, and a lot of this is grounded in decision theory and this concept of perceived ambiguity, and how people don't like feeling confused, and what the sort of behavioral consequences of feeling confused can be things like feelings of backlash or negative beliefs towards health recommendations and research. And then ultimately the concern that both confusion and backlash could lead to lower intentions to engage in healthy behaviors like fruit and vegetable consumption and exercise. And so I found a lot of cross-sectional, so sort of single point in time evidence for these associations, which was concerning, right? It gives rise to this concern that, okay, this may not be, exposure to this kind of information could be problematic. But there's lots of problems with a cross-sectional survey like this, right? We have concerns about reverse causation, right? You can't establish causality with a survey of this kind. There could be lots of other explanations for the associations we observed, other variables that could explain those relationships. And so my next steps were really to try to think about, could I make these findings go away, right? Or do they hold fast even as I increase, let's say, the quality of the research I'm doing? So my first question was, okay, at this point, I just looked at media, but what about interpersonal and medical sources? Do people notice this information in that context? And can I do something about feeling more confident in claims of causality, that exposure to conflicting information actually produces confusion, backlash, and so forth? And the way that I did that was partnering with a colleague of mine, CJ Lee, and one of his graduate students at the time on a population-based survey, but this time a longitudinal survey following the same people over across 3 waves. So giving us a sort of time dimension that makes us feel more confident in causality, and looking also at the relative contribution of both media exposure versus interpersonal sort of family, friends, and medical sources as far as exposure to conflict is concerned. And what we see again is similar. This is now 4 years after that last data collection that I showed you, and we're still seeing a lot of self-reported exposure to this kind of information, really similar sort of prevalence. Interestingly, we see some variation across sources. So lots of exposure from television. Similarly, lots of interpersonal exposure, people coming across this kind of information from family and friends, and frankly, even from their doctors, right? Which I found at the time to be quite interesting. And we can sort of, speculate as to what that information in the medical context might look like. Lots of sort of complex modeling here. Don't worry about getting into the weeds with it. I'll walk you through what I think is most important to kind of take away here. Like I said, it's 3 waves. So you sort of see this first, on the left-hand side, that was the wave 1 data collection where we're measuring that exposure to conflicting information. And what we see is that television exposure specifically produced greater confusion at time 2. Okay, so this is several months later. We're seeing that sort of lagged effect, whereas print exposure actually seemed to reduce confusion. And for those of you who have a background in journalism, this may not surprise you when you think about what health content looks like on, say, TV news versus what it looks like in print news, right? Television news, we have much less. You've got 30-second, maybe 30-second or a minute spots to feature a certain health news story, recent health research study. They may not have time to get into the nuances of the study, the limitations, and so on. And that could give rise to that kind of confusion. Whereas print stories obviously have a lot more bandwidth and space to sort of think through the reasons to help people understand why conflict might exist. Confusion was in turn associated with backlash, replicating what I had seen in my prior work. And we do again see a sort of then to the third wave lagged effect where people who reported greater backlash, sort of those negative beliefs towards nutrition research and recommendations, were less likely to say that they were eating the recommended amounts of fruits and vegetables. Okay, and I'll come back to why the sort of impacts on fruit and vegetables and exercise are important in a little bit. So we've got a cross-sectional survey study, a longitudinal survey study, and then we move to sort of the gold standard, which is experimental research, seeing if I actually show people messages about conflict in the context of nutrition here, specifically in the context of conflicting information about low carb and high carb diets and dietary fats. Does it actually produce, right, strongest causal claims there? Confusion, backlash, and decreased intentions. And that's exactly what we see in the experimental context here too. So taken together, all of this gives you some pause that indeed exposure to conflicting nutrition information could be really having some problematic effects, undesirable outcomes for public understanding and for health behavior. My next concern was, okay, well, is this just about nutrition, right? We know nutrition's a problem. It's pretty salient for a lot of us. We actually, we kind of tend to pay attention to nutrition information, it seems. What about something like cancer screening? Is that, it's a very different type of behavior. There obviously the role of a healthcare provider becomes much more relevant and salient here. Is this also something to be concerned about? And as I mentioned earlier, mammograms in 2009 certainly saw a fair amount of conflict and controversy about recommendations there, but it turns out this is a very long-standing history. Mammography guidelines have shifted many times over the last 30 years. And what we did, my colleagues and I, in a paper we published back in 2019, we looked at just 4 recent public announcements of shifts in recommendations about mammography to see whether over time there was, whether the emphasis on conflict and controversy in media coverage waned or whether it stayed pretty constant. And what we saw actually was really persistent framing this issue of cancer screening in the context of breast cancer screening as one of conflict, where experts just do not agree about the age at which women should start getting screened and how often they should be screened, every year versus every other year, and the age at which they should stop, right? Should they stop? Lots of debate across professional organizations, and the media tends to spend time thinking about and covering that conflict, which can, as you might imagine, given what I said in the nutrition context, could have deleterious effects on women's sort of understanding of mammography, their broader confusion about cancer prevention recommendations and research, and backlash towards those recommendations and research. And that's sort of where we turned at that point. So setting content aside and starting to look at whether people notice this information and whether it might have effects. We did find evidence that women and men, both actually, notice conflicting information about mammography, although to a somewhat lesser extent than they notice information about nutrition. But in an experimental context, when I showed women news stories that featured less conflicting information about mammograms versus still more, sort of a dose response, low, medium, high exposure to conflict, what we see is really a dose response of like more exposure to conflict I'm showing you, the more confused you are about cancer prevention recommendations and research, the more backlash you're experiencing, the more ambivalent you are, right? Mixed feelings about getting a mammogram yourself. And again, something for us to be at least thoughtful and potentially concerned about. I have a note here to say that in this study in particular, I was interested, a lot of my work thinks also about communication and health equity. And I worried in the context of conflicting information that women of lower socioeconomic position might potentially be particularly susceptible to the effects of exposure to conflict, might really struggle with some of the complexity of this information. In fact, we did not see that here, despite specifically sampling, oversampling, stratifying in our design to look for it. Women of all kinds across socioeconomic position were affected by this information in an undesirable way. So that brings me to this more, those are sort of, if you think about classes of effects of exposure to conflict, negative emotional responses, confusion, backlash, ambivalence, those are, cognitive responses that are a little bit more proximate. I increasingly have always really worried about the downstream implications and whether exposure to conflict and its, those affective and cognitive responses, if it might ultimately undermine broader trust in health recommendations and even make people less receptive to subsequent health messages, even about topics for which there's very little conflict, like fruit and vegetable consumption, exercise, colorectal cancer screening, and so forth. And this phenomenon is something I've described as carryover effects, or you could think about it as spillover effect, right? Where you have this sort of movement away from the topic of conflict to a totally different, again, sort of health behavior where there is not expert disagreement. Could we see that sort of bleeding? And if we do, that could be really problematic if we're undermining broader trust in the scientific enterprise, and its implications for public health would be considerable, I think. So we set out to really look for it, in part because in my past work, you may have noticed along the way today, we were seeing potential for this, right? So coming back to that very first study, the fact that I was seeing associations with lower intentions to consume fruits and vegetables and intentions to exercise, even though I was talking about conflicting information about fish and coffee and wine, that's why did I see that connection, right? What is one thing, right, that points to this possibility that there could be this sort of carryover or spillover? We saw it again in that longitudinal study, same pattern, and even in the mammography context, I found evidence of this, right? Where not only was exposure to conflicting information about mammograms producing greater ambivalence or mixed feelings toward mammography, but also mixed feelings about getting other types of cancer screening, right? concerning, because we know that other types of cancer screening, like colorectal cancer, you know, really very quite a lot of expert consensus on that. So for the last few years, my research team and I have been we set out to really do a strong empirical test of this possibility of carryover effects. With support from the National Cancer Institute, we were able to conduct a longitudinal experiment with a general population sample, again, population-based, roughly 3,000 Americans, who were at time one randomized to either a conflict or no conflict condition. And what they saw over really a month-long period is different news stories and social media posts about 6 different health topics for which conflict exists. And I'll show you examples of some of those in a minute. And after that exposure to conflict or no conflict period, we assessed some of those more proximate outcomes like negative emotional responses, confusion, backlash. And then at a third time point, we exposed everyone to actual health campaign ads from existing health campaigns about behaviors for which there is expert consensus. So fruit and vegetable consumption, exercise, and colorectal cancer screening. And we asked after that a series of questions designed to assess receptivity to those ads, right? Including things like message resistance, right? Did you counter argue it? You know, how persuasive did you find these ads? Whole set of questions. I can say more about those if it's of interest. And the hypothesis, the carryover effects hypothesis, would be that those with prior exposure to conflicting information here would be less receptive to those subsequent unrelated health campaign ads. Okay, that was the hypothesis we were trying to test. And so to do this, like I said, the data collection is important because I want to be able to say whatever we find that this generalizes to the broader US population. So we worked with AmeriSpeak at the University of Chicago through NORC, the national, the NORC, I want to say National Opinion Research Center is, I think, what the acronym stands for, although they just go by NORC. Anyway, and the AmeriSpeak panel is probably the most robust population-based panel operating in the US today. And they were able to really track participants across this 6-week-long study, like I said. And so here's an example. We worked with a graphic designer adapting existing news stories for our experimental manipulations here. Here's an example of one of the 6 topics, vitamin D supplementation. And this is the conflict condition and for a sort of desktop or tablet survey taker. And what you'll see here is that we had a couple of different terms and phrases where we were drawing out conflict, right? Cast in doubt, conflicting studies, not everyone agreed, adding to the confusion, et cetera, this kind of language to provide that manipulation of our key concept of conflict versus the no conflict condition where that language is stripped out, but everything else is held constant, okay? And so the only thing that's really changing between these two stimuli into the conditions is the presence of conflict. Similarly, we did the same thing with Facebook and Twitter and other social media stimuli, because of course, people's current media ecology is not just traditional news, right? We know that people are getting their health information through social media as well. And so here's a breastfeeding example where, again, here's our conflict condition for mobile, right? A lot of survey takers now take surveys on mobile, so you need to be sort of platform sensitive. And here's the no conflict condition, again, stripping out that conflict language. So people would have seen, 6 versions of these across 6 different topics. And to simplify the results, I can tell you that we're replicating all of the past work I showed you, where exposure to conflict produces negative affective responses like frustration, distress, annoyance. It produces generalized confusion about health recommendations and research, right? If I find health recommendations to be confusing, it's not clear to me what I should be doing to stay healthy, items like that. And finally, generalized health backlash, right? Sort of this idea that scientists keep changing their minds, recommendations should be taken with a grain of salt, items such as that, right? So very consistent with all of our team's past work. And importantly, we find evidence of carryover effects, and they seem to operate through backlash, right? So the sort of more backlash people experience, the more likely they ultimately are to show resistance to those subsequent unrelated ads. To basically find this ad about fruit and vegetable consumption or exercise or colorectal cancer screening, to find it to be less persuasive than those who had seen those earlier news stories and social media posts, again, about unrelated health topics, seeing those stories and posts without conflict. We saw the same pattern of findings for another outcome, right? Perceptions of the behaviors in those ads were also found to be less compelling. So people reported, for example, lower intentions, weaker attitudes towards fruit and vegetable consumption, and lower intentions to consume fruits and vegetables, again, consistent with my past work. So all of this taken together gives me pause, right? Makes me a little worried that the broader information environment may be creating sort of a context, a climate of mistrust, producing backlash such that we may be undermining people's likelihood, their receptivity to our public health messaging and recommendations. So the last sort of thing I wanted to talk about with you before turning to those implications is really COVID. COVID has sort of, if anything, I think just it's sort of like conflict and controversy on steroids a little bit, right? Where suddenly what we saw in other contexts of, mammography and alcohol and e-cigarettes, in the context of COVID, it gets really, you can't get away from this information, especially in the early months of the pandemic, right? And the level of disagreement across, a number of different issues, whether it's masking or what treatments would be promising, just significant in media coverage of COVID. And sorry, it looks like it skipped through. And so this is both, in the context of both political messengers and also health experts, right? We were seeing, my team and I were seeing this across both types of sources. And so we wanted to empirically assess whether we were the only ones, because we're primed to notice it given our focus of research. So we again worked with NRC, with the AmeriSpeak panel, to survey 1,000 Americans age 18 and older back in April of 2020. And what we saw is, again, really high rates of exposure to conflicting information about COVID. And participants told us that they perceived disagreement across a range of COVID issues, including masking and the like, from politicians more than health experts, but from both, okay? And so if you take this, into account in the context of what I've already told you about the sort of downstream negative effects that exposure to this information can have, COVID's only going to potentially amplify the potential negative consequences of exposure to this information. So, so that's what I'm struggling with now, and trying to figure out a path forward, right? So if we've seen these, these carryover effects, what do we do? How do we address this? Can we address this? And this is where I'll sort of leave you with, some implications and some questions for you to sort of mull over. And I'd be curious to hear your thoughts. But the first question I have is, what can we do about conflicting health information in the media? How do we intervene? Is it possible to intervene? I sit in a journalism school, so I am not a journalist, but I certainly have colleagues who are, and I have colleagues who study journalism, and it's interesting to think about what is a viable path for such intervention. Similarly, what about scientists, research institutions, who are in many ways the gatekeepers of the kind of research and recommendations we're talking about. Other stakeholders, right? What about professional associations like the American Cancer Society, and so on? Ultimately, what are the implications for campaigns? For those of you who do strategic communication, I'd be curious to hear from you. Like, how do you think about these findings in terms of, your next strategic communication effort or other intervention? What are the implications for clinical interactions, right? When people engage with their providers. And finally, again, what are the implications for health equity? Even though I haven't seen in my work so far evidence that historically underserved populations are particularly susceptible to conflicting information, it doesn't mean that it's not there. It just means that I haven't so far seen it in the handful of studies where we've specifically tried to look at it. There's still good reason, I think, to be looking for that and to be sensitive, especially to something like health literacy, research literacy, people's understanding of scientific research and how that could interfere. And ultimately, what our team is doing now is we're trying to think about how to better communicate around evolving science, which is really, as I said earlier in the talk, the crux of a lot of what gives rise to seemingly conflicting information. And so if we can find a way to better talk to the public through the media, but also through other means, about why studies seem to conflict, why recommendations shift, then perhaps maybe that's a pathway for reducing and interrupting the carryover effects that we've observed. But time will tell. So I will probably, I think, leave it there. Here is my contact information, but I would love to hear any of your questions, and certainly if you have any insights or suggestions as far as implications, I'm all ears for that, because I don't have the answers, and we're trying to find them. But I welcome suggestions. Thank you for your time.
Thank you, Rebekah. That was awesome. I found that really interesting, and I think some people are hoping to connect. Would it be all right if we shared your email with people after this?
Oh, yes, of course, of course.
Awesome. So we'll send that out in the follow-up email. We can send some resources, including Rebekah's email. So if people have questions, I would encourage you to put them in the Q&A. As we wait, if people can come up with questions, I had one. I was curious. So earlier on, you showed a graph of where the primary source for this conflicting information originated, and I was surprised to see TV was the biggest. And I was curious, there's two things I was wondering about. One, does that have implications for age demographics that are most affected by these trends? As a young person, I don't watch TV, but my parents do a lot. So I'm curious, does that mean they're going to be more likely to have conflicting information?
That's a great question. Yes. So the demographic patterns, if you look at something like Pew Resource Center, which kind of tracks people's, media habits, they are pretty clear that the people who are still watching TV news, generally speaking, are older. So you're absolutely right about that. And I teach a large undergraduate course at the U on media effects, where we look not just at media effects on health, which is of course my area of research focus, but politics, kids in media, everything. And I always ask my students in that class, I'm like, so where do you get the news? Where do you get your news? And it's never television. So to your point, yes. You're right to point out that therefore you could imagine there would be sort of differential effects. But I would suggest that, those data are quite a number of years old now. And so if we were to repeat that study, we may see, I didn't show you in that chart just, the extent to which people see this content online, especially on social media. Increasingly, I think people are coming across it in those other domains, and that would capture some of those younger demographics. So I don't think anyone's immune and completely spared from this kind of exposure.
That makes sense. And you kind of got to what I was also wondering about is with social media, people have probably seen there's a lot of congressional focus on these large social media platforms. Facebook, they're there right now. So I'm curious, based on the results of your study, should there be more congressional scrutiny directed toward TV or some of these other like maybe the internet at large? It seems like the social media is definitely being focused on right now, but based on your research, I'm wondering if that should be expanded and maybe approached from a different angle. Because it's like misinformation resulting in confusion and inaction versus intentionally misleading information that does result in negative action.
Yeah, so I think there's a lot in your question there. The first thing I would say, yeah, so you mentioned misinformation, and just to be clear, I don't talk about misinformation directly in this talk, but it is absolutely an adjacent phenomenon that we have to be very concerned about. And the way I've always looked at it and thought about it is that conflicting information really creates opportunities for people to weaponize misinformation. That's kind of right. If we are sowing doubt about health recommendations, it creates opportunities for misinformation to creep in and to be leveraged. So that's what I would say about the sort of intersection between these two phenomena of conflict and misinformation. You're right to point out what's happening certainly in the social media space with regards to regulation. I mean, it's a bear. It's a real it's a real quandary, and it's hard. When we think about points of intervention, it's really what you're getting at. Can you intervene with the producers, the health information producers and disseminators? How effective is that? How possible is that in our current, especially political environment? How likely is there the political will for that? Versus how much of this intervention actually has to happen on the audience and receiver side, in terms of training and promoting stronger science literacy and research literacy skills. I don't have the answer to that. I don't know. I have concerns about thinking about it in one way or the other. I think we probably need a multi-pronged strategy that would try to address this from all sides. But we'll see how it plays out with respect to Facebook and regulation at this point. I'm curious, and I don't know.
Well, thank you for getting to my questions. And I think what you were just saying, this kind of multi-pronged approach, somebody from the audience asked a great question, which is, have you considered trying to replicate this research for diverse community media? Similar studies drawing upon metrics from like Latinx radio, cultural print publications. There's a lot of those in the Twin Cities. We've got a lot of different communities here. So I think you're getting to that with this multi-prong. I mean, that there isn't like a panacea of media consumption. So is that something that you're exploring?
I can tell you that I appreciate that question. I, a number of years ago, did some focus group research with ethnic immigrant women in the Twin Cities, women from the Somali community, from the Hmong community, and from the Latina communities, in partnership with West Side Community Health Services. And, I was talking to those women specifically about mammography. It was part of the mammography research I mentioned. And what I can tell you as part of that work, there was no question that it's not as if conflicting recommendations were completely unknown to those women. Some women had not heard about it, but there was some recognition of these shifts. And so that suggests perhaps that, yes, the media diets did look different within some of those groups. And it suggests that at least some of these other kind of sources, these communities, community papers and so on, local ethnic media sources were communicating some of those conflicting messages as well. Not a purposive, not a population-based sample. That was a purposive, study with roughly 50 to 60 women. So I wouldn't want to generalize too far from that. But I think I appreciate the question. I think it's important to be looking at subgroup effects, not only in terms of effects of exposure to this information, but also the sources of this information. So I have not revisited that recently, but I would like to. So yeah, thank you for the question.
Yeah, I don't know. This question might give you an opportunity to expand on that, or maybe you'll feel that you've answered it. But we were just wondering, how do people's life experiences come into play when thinking about how information is communicated, received, and interpreted? Does that, yeah.
Yeah, I mean, that it is a critical issue right now. And I think I haven't said much about a third phenomenon. So if you think about conflicting information as a really important phenomenon that we're seeing in news media and broader media, the broader public information environment as far as health and science specifically are concerned. So conflicting information is one phenomenon, mis and disinformation as another one. I would say the third is really politicization, right? Sort of the politicization of health and science, which we're seeing more and more in the last couple of years. And I think that to this last question, you therefore have to think about people's priors, and specifically this sort of like, their identity, right? Which is often increasingly, frankly, a part, partisanship, and how that shapes the information sources to which they're exposed in the first place, how they make sense of that information. There's other variables that can and do inform that, that we've long known about, but probably the single most important one right now, when we think about how people are exposed and respond to information to which they're exposed, especially in the context of media, is political ideology and partisanship. And it's something that our team is increasingly thinking about, because it has really important implications for public health recommendations and ultimately science, trust in science more generally.
Thank you. This next question is got a lot to set up, but I really like where it gets to, so I'm going to read it off. It's great. So separating the COVID-19 issue, because the political element in this information is another story, it's really hard to go back to a place where we can regulate the information that people are being exposed to, which includes statistics, research, and health-related info. Maybe the best way forward is more information about the why and how. Why do we see different and sometimes conflicting info? And how do we become smart consumers of research? For example, the difference between what CDC clinical trials require for vaccine approval and what the FDA approval involves. And that's why there is a difference. So yeah, the question that I see here that is, I think, really helpful is, how do we become smart consumers of research? I remember the statistic you said earlier. I think it was 1 in 5 Americans, wasn't it, know what a scientific research is?
What's that? Yeah, scientific study. Yeah,
Scientific
because the
study.
National Science Foundation's been looking at this, kind of tracking it, for years in different ways, and it continues to sort of be a struggle. Yeah, I mean, there's no question that I think in my mind, and I've been thinking about this idea of research literacy or understanding of scientific research specifically for a number of years. How do we do it? Right? How do we do that? Is it probably comes down to K-12 education in some ways, right? Sort of integrating and moving, there's been a lot of emphasis, obviously, STEM curricula, right? But to what extent does that incorporate like basic life research, navigation, statistics, understanding of science at more of a meta level, and a methodological level, as opposed to like in-depth STEM topics, right? I don't know. I know I've come across at least a couple of kids who live in my neighborhood who tell me that they're getting statistics in high school, whereas I'd never had that kind of education. And so maybe there's some movement in the K-12 system to make people smarter consumers, starting at that point of research, and to understand research methods. I mean, it's critically important life skills that perhaps have gotten short shrift in our ed system. But of course, that is there you're talking about education policy. You're talking about things that kind of go well beyond my area of expertise. But I agree, there's probably a real need and a real role for that. And so from my perspective, I wonder, as a health communication researcher, I wonder what role people in my space can play in supporting that effort. But I certainly don't think that we're going to carry it on our own.
Thank you. I think one more question that I'll ask here is, how do you avoid these sorts of news conflicts in your own life? Is there a methodology you can share with us?
No. What got so this was the subject of my dissertation work when I was in grad school in the late 2000s. And I remember it was 2008, 2009, and I was specifically reading an article that was published on I think it was on red wine because I love wine. And I was reading about its link to breast cancer. And I was like, wait, but haven't they been saying for years that this was like good for protecting your heart? And like, what am I supposed to do now? And so it was like very personally salient. It's what set me down this whole path. And I realized that there really was not a strong empirical evidence base for any of the concerns that people had. So no, I don't think I'm immune to its effects. I probably have a better appreciation for this content when I'm exposed to it. But when COVID hit and I started seeing what was playing out with shifts and recommendations around masking in particular, holy moly, it's like, my team and I were like, oh my gosh, what are you guys doing? Like, what are you doing? Like we know what this is going to do. Like this, there's not a strong enough appreciation for how science evolves, how it's going to evolve very rapidly with a novel virus where we're learning new things every day, the need to kind of constantly be moving and responding. And this is not going to go well. And indeed, it has not gone well. so I may be able to like notice that more quickly, but I wouldn't say that I'm immune to its effects.
Well, thank you so much, Rebekah. This was really informative. I got a lot out of it, and I hope that everyone that joined did as well. And yeah, we'll send a follow-up tomorrow. People can share the recording and connect with Rebekah and have the conversation go on further. So
Yeah,
thank you,
great.
everyone.
Appreciate it, Kenny. Thank you so much all for your time. And yeah, feel free to email me with any questions or thoughts. And I'm grateful for your tuning in today.
Have a nice evening.
Okay, thanks everyone.